The following is a commercial-free educational program brought to you by the Detroit Wayne Mental Health Authority, which serves adults and children with serious mental illness, intellectual and developmental disabilities, and substance use disorders.
There's always help. And one of the things that people struggle with individuals that have severe mental illness, developmental disabilities, parents of children who have autism spectrum disorder or serious emotional disturbance, is not feeling so alone, not feeling hopeless and helpless about the possibility of help. And so I think one of the things people really need to embrace and keep in mind is that they aren't alone. There are a range of services and supports for people that can make their life better.
Hello, and welcome to Accessing Mental Health Care in My Community. I'm Cynthia Canty. There's no worse feeling than knowing that you or someone you love needs help with a mental illness, intellectual or developmental disability, or substance abuse problem, and not knowing where to go to get that help. Did you know that in this country, 1 in 5 people has some form of mental illness? And that's true right here in Wayne County. It impacts every school, every neighborhood, every zip code. It's a disease that usually starts in childhood, with 75% of those with mental illness experiencing symptoms by age 24. Not getting help only makes these problems grow worse with time. And it can and does tear families apart. But there is help. You or your loved one can live a fuller, happier life. The proper diagnosis, treatment, and support can make a world of difference. For thousands in Wayne County, that help began with a call to Detroit Wayne Mental Health Authority's Crisis Hotline. It serves as the central access point for mental health and substance use services in Wayne County. 800-241-4949. Detroit Wayne Mental Health Authority is the funder and manager for organizations and agencies involved in providing mental health, substance abuse, and related services all across Wayne County. Hundreds of thousands of your family, friends, and neighbors in need call that number every year for help. Realizing that someone needs help and that help is just a phone call away is often the first step on the way to recovery, support, and service. Come along as we meet some inspiring people who needed help, sought it, and are living happier lives because they took that all-important first step.
Good job, all!
We begin with 4-year-old Ali Shumain and his family. They live in Dearborn. Born with Down syndrome, Ali wasn't developing as he should. By age 2, he still wasn't walking or talking.
You gonna dance? 5 little monkey? 5 little monkeys jumping on the bed.
His mom, Zena, knew something was wrong with Ali, but didn't know what to do or where to turn. Through DWMHA's assistance, Zena was introduced to Connections. It's a specialized education and behavioral center in Dearborn, geared to children with behavioral and developmental disabilities. She learned Ali had autism, a developmental disorder. He enrolled in classes and started getting therapy. That changed his life and his family's life.
Matching! Nice job! Let's do another one.
Since he started here, they helped me to teach him how to walk, how to, say word, how to ask, like when he brought a toy to you and he said on. Before he used to just, touch it. Now he say on. So this is something like I really appreciate it.
On. Good job asking for it to be turned on.
Some people, they give up. This is another thing, people, they shouldn't give up.
Blue. Blue.
When you start picking up, you put the puzzle together, it's easy, It's kind of easy, it's a lot of work, but it's easy because you're getting a result.
Ball. Nice job.
So don't give up. For the family, don't ever give up, Work hard and you get the result. Don't let anybody make you down.
Good job.
And thanks for everybody help me with little thing with Ali, Ali, he's the angel of the house.
The Detroit-Wayne Mental Health Authority has been a shining light for people from downriver, Detroit to Belleville, and Grosse Pointe to Northville, and every city and township in between since 1968, as people seek help and solutions. Dr. Cheryl Monday has been working to educate and help the community about the importance of early screening and therapy to help young people, and older folks too, as they confront their mental health disorders. She's an associate professor of psychology at the University of Detroit Mercy and vice chair of the Detroit-Wayne Mental Health Authority Board. That's the largest such authority in the state, serving nearly 80,000 people every year.
It's very important, and one of the things that we see often is that people don't get help when they should, and sometimes suffer needlessly because of their concern about reaching out for help. Maybe they feel that there's some shame involved. Maybe they don't know about services. And it really is very important for people to get help. Without help, people really do suffer. And it can diminish quality of life in a lot of different areas.
Hi, my name is Yvonne. I'm a clinician with the Detroit-Wayne Mental Health Authority.
Yvonne Bostic is a licensed professional counsel at DWMHA's Access Center in Detroit. She and her team are there to help when a call comes through to the 24-hour helpline.
Majority of the calls that I get are, actually they range from children to adults and sometimes seniors looking for mental health services, looking for psychiatric, to see a psychiatrist to get their medications, case management. Sometimes a person has some mental health concerns or developmental disability and they're looking for help with housing or placement. They're looking for life skills or job skills training. They're looking for sometimes just basic necessities, food and shelter and healthcare resources. I think it's very important. A lot of times people don't know, a lot of people don't even know what community mental health, what we offer. And a lot of people don't know that these services are here or available. I bump into people just on an everyday basis that are like, oh, I didn't even know that anything like that existed. Especially like if they have a child that has special needs or a family member who's been suffering with certain mental health. They may see a psychiatrist or a therapist outside, but they didn't know that there was like case management services as well. Mental health is part of our whole being. And a lot of times if your mental health is not in balance with the rest of your components, your physical and your spiritual, then you're just not going to feel right. And trying to help them understand that if something was wrong with your heart or your head or your stomach, you would go to the doctor, and your emotional and your mental is part of your makeup. So if that doesn't feel right, you need to go see someone who can assist with that, and that is okay. There are the services there for that reason and that purpose.
1 in 5 of us has a diagnosable mental illness, yet only 41% of people with mental illness get help. And over 90% of young people who die by suicide have a mental health condition. Sometimes people don't realize they have a problem. Other times, it's the stigma that's all too often associated with mental illness, a stigma that keeps people from getting the help they need. But just as physical illness needs care and attention, so does mental illness. There are many champions across Wayne County working to educate people, working to help, especially in schools where symptoms are first noticed. Latino Family Services in Southwest Detroit recognizes many students are confronting issues such as autism and depression, and they're stepping up to help.
I guess education would be the not knowing where to go, who to go to, where to get information from. Number one, I would see your school social work. Okay. 2, if you cannot see, there are advocate organizations available. Okay. And 3, if there's a language barrier or something, then find someone that can translate for you and know how to maneuver the system. Because if the most social workers will at least be able to do one of those steps for them. And if not, then they need to find different organizations and community organizations that could probably help them out.
DWMHA is providing school-based mental health services in over 70 Wayne County schools, and that makes access to services easier for students and families.
To be able to have those resources in the schools really makes a big difference. It allows children and teens to get the services where they are. It gives the mental health providers an opportunity to really interact with the teachers and other personnel at the school. So you really have more of an integrated or seamless kind of communication.
The state of Michigan is stepping up as well. The state has just launched proven specialized services to people who have an autism spectrum disorder diagnosis. These applied behavior analysis services are available to young people under age 21.
The earlier the intervention, the better, and that's because it is developmental, it is related to development. And if the youngster and the family can get the support that they need early enough, they can kind of get in there while the youngster is still developing, still acquiring some skills, and it can make a real difference.
More than 60 million people in our country have some form of mental illness every year. And some 14 million of them live with mental illness in its most serious forms, such as schizophrenia, bipolar disorder, or major depression. Sometimes these problems go undiagnosed, or people simply don't seek help, and that can cause big problems later in life. Things like substance abuse, homelessness, even jail are frequently offshoots of mental illness. It's estimated over 20% of people in prison and jail have a mental illness. And 70% of young people in the juvenile justice system have at least one mental health condition. The state of Michigan's Homeless Management Information System estimates there are nearly 26,000 people in Metro Detroit who are homeless, many suffering from mental illness. Michael Squirewell doesn't need anyone to tell him the statistics. He has lived them. He lost interest in school at a very young age, began using drugs, and ran away from his home and family. And he got mixed up in gangs, including the notorious Young Boys Incorporated.
I need people that's going to be responsible, reliable.
Michael wound up homeless and did time in jail. He was on a dead-end road until he discovered Central City Integrated Health in Detroit and learned he had bipolar disorder and depression. And that's when he got the help he needed.
They helped me get back on my feet. They helped me get home, a home, go to school. They showed me a way. In the same token, I guess maybe I showed them a way too, about how the streets was, where I came from. And everybody always say my story is different or unique, but it's just one story out of many.
It wasn't easy. It took hard work and determination, but Michael got his life back. He's rebuilding relations with his kids and his mom. He's living in an apartment on Detroit's riverfront.
I finally heard the words I wanted to hear from him. When she told me she was proud of me. When she told me she was proud of me, that was more important to me than anything anybody can ever give me. I can be on TV, I can be famous, I can be a millionaire. None of that mean nothing to me.
And he's working as a peer mentor at Central City, helping others face the very same challenges he once faced. Michael credits the professionals and his peers at the Detroit-based Central City Integrated Health Agency for saving his life.
I like who I am today. I like the people I'm helping today. Where I'm going to today, I may not get rich, I may not be famous, but I'm happy.
Michael even met Michigan Lieutenant Governor Brian Calley and invited the Lieutenant Governor to see the center and gave him a pen to commemorate his visit. The Lieutenant Governor was so impressed with Michael and his inspirational life story, he promised to use the pen Michael gave him to sign state legislation prohibiting the inappropriate uses of seclusion and restraints in Michigan school. Now that is recovery and advocacy in action. The Detroit-Wayne Mental Health Authority is a lifeline for the region. It's committed to maintaining a safety net of services and support for thousands of adults with mental illness, people with intellectual and developmental disabilities, children with serious emotional disturbances, and people with substance use disorders. Help is just a phone call away at 800-241-4949. Kisma Wayne struggled with mental illness for most of her life without getting help. She wound up homeless and separated from her husband and her 3 children. She reached rock bottom and knew she needed help. That's when she reached out to DWMHA, and that's how she found the Neighborhood Service Organization in Detroit.
The apartment was fully furnished, which I was extremely happy about because, of course, I couldn't afford any furniture or anything. When we're real busy in life, We don't really pay attention to the simple things. And flowers are something that's simple that a lot of people don't pay attention to.
Today, she lives in an apartment provided by NSO and enjoys her life.
You can never tell what's in a man's mind, but if he's from Harlem, ain't no sense in even trying.
She was recently diagnosed with breast cancer, but Kisma brings her new positive outlook to her cancer battle, and she's still getting support from the Neighborhood Service Organization.
Good. My advice is go with your first mind. Don't be like I did and wait and put it off. Don't say, well, I'll do it tomorrow, because tomorrow may not happen. It's going to open up a window of opportunities for you. All you have to do is just take the first step. And I also want to say, be patient, because things don't happen overnight. We didn't get into homelessness overnight. That did not happen to me overnight. That happened to me over a course of time. So this is going to take place over a course of time. For me, it was 6 months. Just make steps, even if they're baby steps. Just make steps towards, your goal. And your goal is to get better. That's my song. I'll stick it to it.
Mental illness and depression leave their mark on our communities in other ways, too. Substance abuse is often linked to mental health disorders. Certainly, drug abuse is a major problem in Michigan. We rank 18th in the nation for drug overdose deaths. The Michigan Prescription Drug and Opioid Commission tells us prescriptions for opioid-related drugs increased from 180 million in 2007 to 745 million in 2014, more than quadrupling our state's prescriptions for painkillers. Opioid deaths in Michigan have also risen 742% since 1999, and Wayne County is among the top 8 counties in the state. 12% of Wayne County residents over the age of 12 use illicit drugs every month. That's higher than their national rate of 9.8%. Seeing the huge spike in overdoses involving opioid painkillers, Detroit-Wayne Mental Health Authority began training and supplying first responders with naloxone kits. This drug reverses the effects of an opioid overdose. The kits can mean the difference between living and dying from an overdose. First responders from dozens of agencies, including the Michigan State Police, Dearborn, Inkster, Highland Park, Hamtramck, Melvindale, Detroit Fire Department, Detroit EMS, and Detroit Transit Police are among those who've been trained to use these naloxone kits. Inkster police officer Sue Bouvet has saved 5 lives with naloxone kits.
A lot of times I just carry one already preloaded. And then you just take this little purple thing off. You twist it on and it is ready to go in the nasal. And I usually put half in each nostril. You can do one in each, one in the whole nostril, but you give the whole entire thing, which is 2 milligrams of naloxone. One of the 5, I know if I hadn't had the kit, she would have absolutely died. So it's definitely helped us because we're usually the first one on the scene. We're there before the paramedics, there before the fire rescue, 9 times out of 10. So with us being there and having the kits, it's been really beneficial for us to help the citizens first because we're first there. And we're not standing around not doing anything. They're always looking for, help in an immediate situation like that when a loved one is unresponsive, not breathing, unfortunately turning blue, whatever the case may be. It's a really bad feeling as an officer to get there and not be able to do anything. So it's a good feeling to actually be able to do something and be trained in it and it be successful.
A call to 800-241-4949 will bring help in a crisis or emergency. Organizations like Community Outreach for Psychiatric Emergencies, C.O.P.E. in Livonia, are there to help.
Thank you for calling C.O.P.E. This is Ms. Howard, the Communications Specialist. I'm ready to direct your call.
C.O.P.E.'s Sabrina Cesar is a mobile crisis team clinician. She connects people who need help with a community provider.
C.O.P.E. started because, for one, there's not a pilot program here, I believe in Wayne County, that has a collaboration with social workers going into the hospital and assessing patients. For a while, the process was all the screenings were done over the phone, and then a recommendation for a level of care was determined based on the assessment. The critical part to this is that it's very, very, very important to be able to speak with the person face to face and do a face to face interview. And specifically to help get patients out of the ED by providing them with services, connecting them with services that they would otherwise not know about.
Okay, what we got? Garden City.
We are heading to Garden City Hospital. Seeing a patient in person and letting them know that there is a real life person that's here to hear your story, assess you, and walk you through the process of connecting you with services is really different than just taking a telephone call and getting the information about the patient over the phone and having a determination made on a person's life based on what was assessed about the patient from the social worker. So I think that face-to-face contact is critical in making such an important decision on another human being.
Every day is still a process, and you're still working on yourself.
Peer support specialists, what we do, how we play our part of the team is we assist the clinician when we're out in the field, be at the hospitals or in the community, using our experience. Mostly peers are people that have had mental health issues and experiences, or that should be, or hopefully are in what they call, some people may call remission, or we would like to call recovery aspects. And we use our experiences as the interviews or the willingness sessions are taking place. We use our expertise and our experiences to help guide along creating a person-centered plan for the consumer. I'm here at the service. I'm not the clinician. I'm just a peer. Through the grace of God, I have been through an experience that I hope it can help a lot of people.
Pat Stropes knows all about being a danger to himself and others. This Eagle Scout began drinking at age 16, and soon he was drinking a gallon of hard liquor a day. He began using Vicodin, mixing it with alcohol, and then moved on to Adderall, and all of that landed him in jail. Pat wound up in a Wayne County drug treatment court. These courts are for nonviolent offenders and veterans. The goal? To help defendants who have a mental illness and substance use disorders overcome their addiction and the criminal behaviors associated with addiction. As part of his court-ordered treatment, Pat was sent to Eastwood Community Clinic. He lived there for 15 months. That's where he began therapy and learned he had depression. Today, he's 3 years clean and sober and rebuilding his life and relationships with his family and friends. He completed an 18-month sobriety court program, and that allows people convicted of certain drunk driving offenses to obtain a restricted driver's license after admittance into a sobriety court and after installing an ignition interlock device on their vehicle. Pat now helps others as a peer mentor.
I always thought I was depressed, but that was more so, I think, when I ran out of alcohol or drugs. My main issue was alcoholism and drug addiction. So it was, alcohol being vodka, scotch, whatever was available, and I got addicted to Adderall and hydrocodone as well. It was selfish. Everything revolved around me and my use. I had total disregard for them. You can't get through addiction by yourself. It starts with places like the Detroit Wayne Mental Health Authority. You help people. It's the rehabs and the people that are in recovery that work there. It's the people like the company that I work for, the agency that I work for, and many others that are out there that continue to help people to get through this. Because if you were left to do it on your own, well, I can attest to 4 times I tried to do it on my own, and it doesn't work. And I have not yet to meet the needle in the haystack that has done it on their own. So I've had a lot of spiritual experiences. I call them that because I don't call them coincidences. There's too many. You may have 2 or 3 things that may go your way and may be considered a coincidence. But there were too many different things that have happened in my life, multiple things that have put me where I am today. Because I'll tell you, I became an animal. And it's because of the people that didn't give up on me that I'm able to sit here and talk to you today. And I have to do this. When I was asked to do this, I usually won't go on camera and talk. I save it for groups. But the authority asked me to do this, and I said I will for the authority, because I get you. Because I owe them.
Getting help for your mental illness or substance abuse is critical. As you've just seen, it's never too late to make your life better. Calling DWMHA's 24-hour hotline is the first step in changing your life. The only thing worse than not knowing where to get help is knowing help is available and not making the call.
Well, calling our 24-hour hotline could be the first step of truly changing your life. The only thing worse than not knowing where to call for help is knowing help is available and not picking up that phone and giving us a call. We're available to you 24/7, 365 days a year, so that call can make all the difference in your life or in the life of someone you love.
People should know that that number connects them to someone who's going to be able to sort out the particular kind of help that they need and where they should go.
Keep this hotline number handy, 800-241-4949, because you never know when you, a family member or friend, might need someone to talk to. Calling for help can change, even save a life. We hope you've enjoyed accessing mental health care in my community. I'm Cynthia Canty. Thank you so very much for watching. DWMHA Board of Directors is consumer and community focused, with half of the members recommended by Detroit Mayor Mike Duggan and half recommended by Wayne County Executive Warren Evans. The Wayne County Commission is the ultimate appointment authority.
People are always anxious and afraid to call, and I would say this was true when I worked in a hospital, it's true in my own practice, it's true at a university clinic. And that's because regardless of how severe or difficult the challenge or struggle that a person has, it's hard to think about what you're going through and how you're going to address it. And because often there is shame associated with calling a mental health professional, and often people then have to think about things in their life that aren't going the way that they want to. So hope is very, very important. And if people can make that first step, often what they'll find is somebody who's very willing to listen and very accepting, and then they can take advantage of that as well as to really get some hope about their situation in the future.
One of the things that we know is that with the proper diagnosis, treatment, and support, recovery and help is available. You need to take that time to pick up the phone, reach out, make that call. It could be a difference that would save your life or save the life of somebody you love.
This has been a commercial-free educational program brought to you by the Detroit Wayne Mental Health Authority, which serves adults and children with serious mental illness, intellectual and developmental disabilities, and substance use disorders.